a surgeon who performed surgery on himself. In 1921, a 60-year-old man lay on an operating table at Kane Summit Hospital in Pennsylvania. Bright lights hovered overhead. Surgical instruments were arranged neatly at his side. Nurses stood still watching. The strangest part, he wasn't waiting for the surgeon to arrive. He was holding the scalpel. That man was Evan O'Neill Kane, and he was about to remove his own appendix, fully awake, using only local anesthesia. No drifting into sleep. No loss of control. Just focus, experience, and an iron calm. This was not a stunt. It was a carefully planned experiment, and Kane himself was the evidence. A doctor who questioned a normal surgery. At the start of the 20th century, surgery was already improving, but it was still dangerous. Doctors relied heavily on general anesthesia, usually ether or chloroform, to put patients completely to sleep. These drugs reduced pain, but they also carried serious risks. Patients could stop breathing. Some slipped into comas. Others never woke up. Dr. Kane had seen this firsthand. After decades as a surgeon, he became convinced that the anesthesia was often more dangerous than the surgery itself, especially for patients with heart disease or advanced age. He believed many operations, particularly appendectomies, could be safely done using local anesthesia, which numbs only the surgical area while the patient stays awake. The problem was fear. Patients were terrified of being conscious during surgery. Other doctors doubted that a person could remain calm or still enough for such a procedure. Kane needed proof that could not be argued away, so he chose the most convincing patient possible, himself. The operating room, silent and tense. On February 15, 1921, the operating room felt different from any other day. Kane lay half-reclined, supported by pillows. Mirrors were carefully positioned above and beside his abdomen so he could see the surgical field. Operating on oneself is not just painful, it is mentally demanding. Every movement appears reversed in a mirror. Left becomes right, forward becomes backward. Kane had to constantly correct his instincts while performing delicate, precise movements. Beside him stood his chief nurse, Mary Johnson, who helped steady the mirrors and assist as needed. Kane's brother, Dr. Tom Kane, waited close by, ready to take over instantly if the situation turned dangerous. Other nurses stood in tense silence, fully aware that a single mistake could be fatal. This was not chaos. It was control under pressure. An unexpected discovery inside his own body. After injecting himself with Novocaine, Kane made the first incision. He worked slowly and methodically, clamping blood vessels, just as he had done thousands of times before. Then he realized something was wrong. When he reached his appendix, Kane discovered that it was wrapped in dense, old scar tissue known as adhesions. This was not an easy case. These adhesions, likely caused by years of chronic inflammation, made the appendix difficult to separate and remove. The surgery instantly became more complex. This was Kane's unplanned moment of truth. He had not chosen a simple operation. He was now dealing with a real complication while awake, calm, and guided only by mirrors. As Kane leaned forward to improve his view, a loop of his small intestine slipped out through the incision. In abdominal surgery, this event, called evisceration, can occur, but it is always alarming to witness. Kane did not panic. With steady hands, he gently guided the intestine back into place and continued the operation. After about 30 minutes, he freed and removed his appendix. Only then did he allow his brother and the nurses to close the incision. By the next day, Kane was sitting up. Soon after, he returned to work. He had proven his point. Why this changed medical thinking? What Kane demonstrated was simple but powerful. He showed that major surgery did not always require putting the entire body to sleep. He proved that local anesthesia could reduce risk, shorten recovery time, and make surgery safer for patients who were too weak or too old to tolerate general anesthesia. By experiencing the procedure himself, he also gained a deeper understanding of patients' fear, pain, and anxiety, which helped him become a more careful and compassionate surgeon. In one operation, Kane challenged fear, tradition, and medical habit all at once. The danger is here. A statement for the elderly. More than a decade later, Kane made his boldest argument yet. In 1932, at the age of 70, he developed a painful hernia. At the time, many elderly patients were denied surgery, not because the operation itself was impossible, but because doctors feared their hearts would not survive general anesthesia. Kane refused to accept this logic. He decided to operate on himself again, using local anesthesia, and invited reporters to watch. His goal was clear: to prove that age alone should not prevent life-saving surgery. During the procedure, as his instruments approached major blood vessels, Kane paused and spoke quietly. "The danger is here." The room went completely still. Then he continued and succeeded. This was not bravado. It was advocacy for patients who were often dismissed as too old to help. A surgeon who wanted to feel what patients feel. Despite the drama of his actions, Kane's motivation was deeply human. He wanted to understand surgery from the patient's point of view. The fear of being awake, the strange vulnerability, the effort it takes to remain calm while someone cuts into your body. After his self-appendectomy, Kane said he finally understood how to adjust anesthesia more precisely and how to speak to patients with greater honesty and reassurance. He also introduced ideas far ahead of his time, including playing music in operating rooms to calm patients, designing safer tools for emergency and field surgery, improving care for injured railroad and factory workers. Everything he did pointed toward one goal: making surgery kinder without making it more dangerous. The irony of his final illness. Dr. Evan O'Neill Kane survived his own scalpel multiple times, but in 1932 he died of pneumonia, then known as the Captain of the Men of Death. Antibiotics like penicillin would not become widely available until years later. There was no bold experiment that could save him from the limits of his era. The irony is striking. A man who mastered pain, precision, and risk could not outrun history itself. Why his story still matters. Today, no doctor would be allowed to operate on themselves. Ethics boards, safety rules, and modern medicine have changed for the better, but Kane's story still matters. Because progress often begins when someone is willing to question what everyone else accepts and to personally carry the risk of being wrong. On that operating table in 1921, staring at his own reflection and working through scar tissue and reversed images, Kane was not trying to be fearless. He was trying to be useful, and sometimes that is the bravest thing of all.
It's time to study new words in context. 1. Hover. Definition: to remain suspended in the air, or stay close to something without fully settling or touching it. Example: the bright surgical lights seemed to hover above the operating table as the surgery began. 2. General anesthesia. Definition: a medical method that puts a patient into a deep, unconscious sleep, so they feel no pain during surgery. Example: in the early 1900s, general anesthesia was dangerous because some patients never woke up. 3. Local anesthesia. Definition: a medical treatment that numbs only a specific part of the body, while the patient remains awake. Example: Kane used local anesthesia, so he could stay conscious during his own surgery. 4. Appendectomies. Definition: surgical operations in which the appendix is removed from the body. Example: after performing thousands of appendectomies, Kane knew the procedure better than almost anyone. 5. Argued away. Definition: to dismiss or weaken an idea by using reasoning or evidence against it. Example: Kane's success could not be argued away by critics who doubted local anesthesia. 6. The surgical field. Definition: the specific area of the body where a surgical operation is being performed. Example: mirrors were placed so Kane could clearly see the surgical field during the operation. 7. Novocaine. Definition: a local anesthetic drug used to numb a part of the body and reduce pain without causing unconsciousness. Example: Kane injected Novocaine into his abdomen before making the incision. 8. Incision. Definition: A controlled cut made by a surgeon to open the body during an operation. Example: Kane made a careful incision before beginning the most difficult part of the surgery. 9. Adhesion. Definition: bands of scar tissue that cause organs or tissues to stick together inside the body. Example: adhesions around Kane's appendix made the surgery far more difficult than expected. 10. Evisceration. Definition: a medical condition in which internal organs protrude through a surgical opening. Example: when a loop of intestine slipped out, the moment became a case of evisceration. 11. Intestine. Definition: a long, tube-like organ in the abdomen that helps digest food and absorb nutrients. Example: a loop of Kane's small intestine briefly emerged during the operation. 12. Hernia. Definition: a condition in which an internal organ pushes through a weak spot in surrounding muscle or tissue. Example: Kane later performed surgery on himself to repair a painful hernia. 13. Bravado. Definition: a display of confidence meant to impress others, often hiding fear or uncertainty. Example: Kane's calm behavior was not bravado, but the result of deep professional experience. 14. Vulnerability. Definition: the state of being exposed to physical or emotional harm or weakness. Example: by becoming his own patient, Kane experienced the vulnerability all surgical patients feel. 15. The captain of the men of death. Definition: a historical nickname for pneumonia, coined by John Bunyan, reflecting how deadly the disease was before antibiotics. Example: Kane survived his own surgeries, but eventually died from the captain of the men of death.
Comprehension questions. 1. Who was Evan O'Neill Kane? Answer: Evan O'Neill Kane was an American surgeon who lived in the early 20th century and became famous for performing surgery on himself to prove the safety of local anesthesia. 2. What unusual action made Dr. Kane famous in 1921? Answer: he removed his own appendix while fully awake, using only local anesthesia. 3. Why did Kane believe general anesthesia was dangerous? Answer: he believed general anesthesia could stop breathing or strain the heart, especially in elderly patients or those with heart problems. 4. What kind of anesthesia did Kane use on himself? Answer: he used local anesthesia, specifically Novocaine, which numbs only one area of the body. 5. Why did Kane decide to be his own patient? Answer: he wanted undeniable proof that local anesthesia could safely be used for major surgery, and to understand surgery from a patient's perspective. 6. How did Kane see his own abdomen during the surgery? Answer: he used mirrors positioned above and beside him to see the surgical area. 7. Why was operating with mirrors especially difficult? Answer: because movements appear reversed in a mirror. Kane had to mentally correct every motion of the scalpel. 8. Who assisted Kane during the 1921 surgery? Answer: his chief nurse, Mary Johnson, assisted him, and his brother, Dr. Tom Kane, stood ready to take over if needed. 9. What unexpected problem did Kane discover during the surgery? Answer: he found that his appendix was surrounded by dense scar tissue called adhesions, which made the surgery more difficult. 10. What happened when Kane leaned forward during the operation? Answer: a loop of his small intestine slipped out through the incision, a condition known as evisceration. 11. How did Kane react when the intestine slipped out? Answer: he remained calm, gently placed it back inside, and continued the surgery. 12. How long did the self-appendectomy take? Answer: the surgery took about 30 minutes. 13. Why was Kane's hernia surgery in 1932 especially important? Answer: he performed it to show that elderly patients could safely undergo surgery with local anesthesia. 14. What famous sentence did Kane say during the hernia surgery? Answer: he said, "The danger is here." 15. Why is Evan O'Neill Kane's story still important today? Answer: his story shows how challenging medical traditions and prioritizing patient safety helped make surgery safer and more compassionate.